does it pose any danger to humans? Dr. Biju has said in his research that
Good morning. Welcome to News for Hearing Impaired. I'm Anil Thomas. With me, Manisha, this morning. First up, the headlines. Detailed guidelines for Lockdown 2.0 to be released today after Prime Minister Narendra Modi had yesterday announced the second phase of lockdown till May 3rd. Home Minister Amit Shah speaks to Maharashtra Chief Minister Uddhav Thackeray, expresses concern over the large gathering in Mumbai yesterday. Shah assures the nation there is sufficient stock of food, medicine and essential commodity. No need to panic. No passenger trains or flights till May 3rd during the extended lockdown period. Ministry of Railways appeal to people to stay home and not to believe in rumors. Number of active positive cases in the country stand at 9,272. Around 1,200 recover, while the death toll stands at 353. Maharashtra and Madhya Pradesh continue to register maximum COVID-19 fatalities. In a major relief to the stranded professionals in the United States, Department of Homeland announces relaxation in visa rules. Now the professionals and tourists can apply for 8-month extension of visa. And as the death toll due to COVID-19 in the United States nears 26,000, President Donald Trump announces withdrawal of funding to the World Health Organization, accusing the organization responsible for hiding the ferocity of the pandemic. Well, now for the stories in detail. Detailed guidelines for the extended nationwide lockdown will be announced today. Prime Minister Narendra Modi had announced on Tuesday the extension of lockdown till May 3rd. Addressing to the nation, Prime Minister had said that lockdown 2.0 will be stricter for the coming days till April 20th. That's when a thorough review of the situation at all levels will be undertaken. After that, conditional relaxation in areas which are outside of COVID-19 hotspots may be implemented. Prime Minister Narendra Modi, in his address to the nation, said that a detailed set of guidelines will be brought out about the conditional withdrawal of lockdown from 20th of April, keeping in mind the interests of the daily wage earners and farmers. The conditional withdrawal of lockdown will be permitted only in those areas where the spread has either been contained or prevented. In his address to the nation, Prime Minister Narendra Modi appealed for people's support in these testing times. He urged the public to follow 7 rules. Extra care for the elderly, following social distancing at all cost, ensure proper nutrition and maintain immunity, download Arogya Setu app, care for the needy and respect those who are fighting this war on the front line.
मैं आपका साथ मांग रहा हूं, 7 बातों में आपका साथ। पहली बात, अपने घर के बुजुर्गों का विशेष ध्यान रखें, विशेषकर ऐसे व्यक्ति जिन्हें पुरानी बीमारी हो, उनकी हमें एक्स्ट्रा केयर करनी है। उन्हें कोरोना से बहुत बचाकर रखना है। दूसरी बात, लॉकडाउन और सोशल डिस्टेंसिंग की लक्ष्मण रेखा का पूरी तरह पालन करें। घर में बने फेस कवर या मास्क का, और वो भी घर में बने हुए, उनका अनिवार्य रूप से उपयोग करें। तीसरी बात, अपनी इम्यूनिटी बढ़ाने के लिए आयुष मंत्रालय द्वारा जो निर्देश दिए गए हैं उसका अगर हम पालन करें, गर्म पानी है, काढ़ा है, इनका निरंतर सेवन करें। चौथी बात, कोरोना संक्रमण का फैलाव रोकने में मदद करने के लिए आरोग्य सेतु मोबाइल ऐप जरूर डाउनलोड करें। दूसरों को भी इस ऐप को डाउनलोड करने के लिए प्रेरित करें। पांचवी बात, जितना हो सके उतने गरीब परिवार की देखरेख करें, उनके भोजन की आवश्यकता पूरी करें। छठी बात, आप अपने व्यवसाय, अपने उद्योग में अपने साथ काम करे लोगों के प्रति संवेदना रखें, किसी को नौकरी से न निकालें। सातवीं बात, देश के कोरोना योद्धाओं, हमारे डॉक्टर, नर्सेस, सफाई कर्मी, पुलिसकर्मी, ऐसे सभी लोगों का हम सम्मान करें, आदर पूर्वक उनका गौरव करें।
Home Minister Amit Shah on Tuesday called up Maharashtra Chief Minister Uddhav Thackeray and expressed concern over the gathering of a large number of people in Mumbai's Bandra area in defiance of the ongoing lockdown. Shah stressed that such events weaken India's fight against coronavirus and the administration needs to stay vigilant to avoid such incidents. He also offered his full support to the Maharashtra government. Over 1,000 migrant workers who earn daily wages gathered in Bandra, Mumbai, demanding transport arrangements to go back to their native places hours after Prime Minister Narendra Modi announced the extension of the coronavirus enforced lockdown till May 3rd. Ministry of Railways has clarified that all passenger train services will remain suspended till May 3rd, 2020 in lieu with the national lockdown. The Railways Ministry has appealed to people to stay home and not believe in rumors. The ministry has also said that full refund will be provided automatically by IRCTC. Users need not cancel e-tickets. Full fare will be credited back to the users' accounts. Besides railway, flight operations will also be halted during the extended lockdown period. All domestic and international airlines have been suspended till May 3rd. Meanwhile, the total number of active COVID-19 cases across the country has gone up to 9,272. The death toll stands at 353. 1,189 people have been cured and discharged, while one person has migrated. Maharashtra and Madhya Pradesh continue to register maximum COVID-19 fatalities. In its daily briefing, the Health Ministry, along with the Ministries of Home and Finance, as well as institutions like ICMR, highlighted the efforts taken by the government in order to help the people. The Ministry of Home Affairs representatives said that 80 crore people will receive 5 kg rice for the next 3 months. The Home Ministry representative also added that they have resolved 5,000 complaints till now. The ICMR representative gave out the data that 2.3 lakh samples have been tested so far. He added that currently we have enough kits available to test people for the next 6 weeks. A new installment of RT-PCR kits has been received and 33 lakh additional RT-PCR kits are ordered. A consignment of 37 lakh rapid testing kits too is expected soon, and the Health Ministry representative highlighted over 218 Lifeline Udaan flights have flown to deliver medical equipments sent to remote areas. He said that the focus is on northeastern states, island territories and hill states. Adding on, he said that 31 people have died in the last 24 hours. To tackle the issue, 602 dedicated COVID-19 hospitals are ready. The hospitals equipped with 1,06,719 isolation beds and 12,024 ICU beds. The Health Ministry said that the main focus is to break the chain of transmission. If no cases are reported for 28 days from a specific area, it can be said that the chain of transmission is broken. To combat coronavirus, the Defence Research and Development Laboratory, Hyderabad, has added another product to the portfolio of Defence Research and Development Organization by developing COVID-19 sample collection kiosk. The unit has been developed by the DRDL in consultation with the doctors of Employee State Insurance Corporation, Hyderabad. The COVSAC is a kiosk for use by healthcare workers for taking COVID-19 samples from suspected infected patients. Patients under test walk into the kiosk and a nasal or oral swab is taken by the healthcare professionals from outside through the built-in gloves. The kiosk is automatically disinfected without the need for human involvement, making the process free of infection spread. The shielding screen of kiosk cabin protects the healthcare workers from the droplets transmission while taking the sample. This reduces the requirements of PPE changed by healthcare workers. After the patient leaves the kiosk, 4 nozzle sprayers mounted in the kiosk cabin disinfect the empty chamber by spraying disinfectant mist for a period of 70 seconds. It is further flushed with water and UV disinfection. The system is ready for next use in less than 2 minutes. Voice command can be given through two-way communication system integrated with the COVSAC. It is possible to configure COVSAC to be used either from inside or outside as required by the medical professionals. The COVSAC costs nearly 1 lakh and the identified industry based at Belgaum, Karnataka can support 10 units per day. The DRDO has designed and developed 2 units and handed over these to the ESIC hospital in Hyderabad after successful testing. The Revenue Department has launched electronic delivery of gate passes and final bills of entry to custom brokers and importers with an aim to further simplify import clearance process by reducing human interface and help tackle the score of COVID-19. The Central Board of Indirect Taxes and Customs said the measures will be effective from Wednesday. The CBIC said that it has taken a number of measures to help and expedite custom clearance process, making it more and more contactless in order to mitigate the unprecedented situation due to COVID-19 pandemic. These measures include the facility to clear goods on the basis of an undertaking, not bond, and acceptance of electronic country of origin certificate. The e-gate pass copy will be used by the gate officer or the custodian to allow physical exit of the imported goods from the customs area. Prime Minister Narendra Modi spoke on phone with Mahmoud Abbas, the President of the State of Palestine. Prime Minister conveyed the greetings to the President and the people of Palestine for the forthcoming holy month of Ramadan. The two leaders discussed the challenges posed by the ongoing COVID-19 pandemic and appraised each other of the steps being taken in the respective countries to control the situation. The two leaders agreed to remain in touch at appropriate levels to explore avenues of cooperation at this challenging time. A lot of fake news is all over social media. One such claim is that money transferred to accounts under the PM Garib Kalyan Yojana will be taken back if not withdrawn. The Press Information Bureau of the Government of India, that's the PIB, has called it a rumor and clarified that money will not be taken back from the accounts. Another claim is that in the midst of difficult circumstances, the Prime Minister is helping every Indian with 15,000 rupees. To get that, one needs to click on a link and fill the form. The claim is absolutely false and the link is fraud. You are well advised to refrain from rumors or fake news. In a big relief for thousands of stranded Indian professionals in America due to the coronavirus pandemic, the US government has decided to accept their H-1B visa applications for an extended stay in the country. The H-1B visa is a non-immigrant visa that allows US companies to employ foreign workers in specialty occupations that require theoretical or technical expertise. The US Department of Homeland Security, in a new notification, has said it recognizes that there are immigration-related challenges as a direct result of the coronavirus pandemic. US President Donald Trump on Tuesday has instructed his administration to at least temporarily halt funding to the World Health Organization or WHO over its handling of the coronavirus pandemic. Addressing a news conference, President Trump said the WHO had failed in its basic duty and it must be held accountable. He said the group had promoted China's disinformation about the virus that likely led to a wider outbreak of the virus than otherwise would have occurred.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. The organization's leading sponsor, the United States, has a duty to insist on full accountability. One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. They were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China, saving untold numbers of lives. Thousands and thousands of people would have died.
Meanwhile, the WHO has been appealing for more than $1 billion to fund operations against the pandemic. The UN agency needs more resources than ever as it leads the global response against the disease. Meanwhile, reacting on US decision of halting funds to the WHO, the United Nations said that this is not the time to reduce the resources of WHO. United Nations Secretary General Antonio Guterres said now is the time for solidarity to stop the virus and not the time to reduce the resources for the operations of the WHO or any other humanitarian organization in the fight against the virus. The United States has registered a record 2,228 deaths from the COVID-19 in the last 24 hours, according to a tally by the Johns Hopkins University. At least 25,981 people in the United States have died so far, the highest of any country. A total of 10,842 New York residents have died due to COVID-19, nearly half of the total across the country. The largest number of fatalities is still in and around New York City, the most populous US city with more than 8.6 million people. The total confirmed cases of COVID-19 in the United States has crossed the 6 lakh mark. Meanwhile, France officially registered more than 15,700 deaths from coronavirus infections on Tuesday, becoming the fourth country to go beyond the threshold after Italy, Spain and the United States, while the rate of increase of fatalities is slightly up again after steadying the days before. But the number of people in intensive care units fell to 6,730 from 6,821 over the last 24 hours, with this total declining for a sixth consecutive day. The national lockdown extended to May 11th to contain the disease. Deaths from the COVID-19 epidemic in Italy rose by 602 on Tuesday, up from 566 the day before, posting a second consecutive daily increase, but new infections slowed to 2,972 from 3,153, seeing the smallest daily tally since March 13th. The total death toll since the outbreak came to light on February 21st rose to 21,067 people, the Civil Protection Agency said, the second highest in the world after that of the United States. The number of officially confirmed cases climbed to 1,62,488 people, which is the third highest global tally behind those of the United States and Spain. The Nepal government has decided to extend the nationwide lockdown till April 27th as infection climbed in the country to 16. The decision was taken at a cabinet meeting held in Kathmandu. This is the third extension since the lockdown was imposed in the Himalayan nation on March 24th. The cabinet has also decided to suspend all commercial international flights till April 30th. Nepal so far has registered 16 cases of COVID-19, out of which 15 are active, whereas the first one has recovered. 2 new cases of coronavirus were reported. With this, the total number of cases has gone up to 16 in the Himalayan nation. The United Arab Emirates on Tuesday confirmed 412 new cases of COVID-19 and the recovery of 81 patients so far, according to the Ministry of Health. The total number of cases in UAE now stands at 4,933. Although the number of cases reported daily has been increasing, the country's health ministry said this was due to increased testing being done in recent weeks, leading to more cases being identified. According to the UAE health authorities, the new cases identified are in a stable condition and are receiving treatment. In Saudi Arabia, 435 new cases have been registered, taking the total number of confirmed cases to 5,369. According to the Saudi Ministry of Health, 8 new coronavirus-related deaths have also been recorded, taking the total fatalities in the kingdom to 73. Jordan, meanwhile, will not allow public worship in mosques during the holy month of Ramadan that begins next week as part of the measures to stem the spread of COVID-19. Jordan Religious Affairs Minister said that the evening prayers known as Tarweeh, a main part of the religious observance of the month-long fasting, would be banned. As in other Muslim countries, the authorities have closed mosques and public places of worship as part of a tight lockdown and the ban on gatherings to stem the spread of the virus in a country with 391 confirmed cases and 7 reported deaths. In Brazil, a 99-year-old World War II veteran was released from hospital with military honors on Tuesday after recovering from COVID-19. The World War II veteran Emando Pivete became the oldest Brazilian to recover from the coronavirus. Wearing an army cap and saluting from his wheelchair, Pivete left the Armed Forces Hospital in Brasilia to an ovation from medical staff and a soldier's trumpet homage. In United Kingdom, a 99-year-old war veteran has raised more than £2 million for British health workers by attempting to walk the length of his garden 100 times before his 100th birthday later this month. Retired Captain Tom Moore, who has used a walker to move around since breaking his hip, was grateful to the National Health Service for the treatment he received in the past and wanted to do something in return. Britain's state-funded NHS is under severe strain as it treats a large number of people suffering from COVID-19. The death toll from COVID-19 in Britain hospital reached 12,129 when last reported. The BCCI on Tuesday advised IPL franchisees that the occasion stands postponed indefinitely after the lockdown to fight the COVID-19 pandemic was extended until May 3rd, leaving no scope for the league to happen throughout this designated window. BCCI had reached out to all the stakeholders together with the 8 franchisees and the broadcasters to convey that the occasion stands postponed and not cancelled. The sole window for an IPL within the present year could be between September and November, subject to Cricket Australia and the ICC complying with rescheduling the World T20. The 6-month journey restrictions in Australia finish on September 30th if the state of affairs turn into regular and the World Cup is scheduled in October and November down under. That's all we have time for. Thanks for watching. Stay safe, stay indoors, stay positive.